students. Today the class will be from mental health nursing, and the topic that we are going to discuss today is on ADHD. So ADHD is nothing but attention deficit hyperactive disorder. Alright, so coming to the introduction of ADHD, they say that attention deficit hyperactive disorder or ADHD is a brain disorder. So this disorder is related to brain disorder, okay, and this disorder comes under childhood and adolescent psychiatry disorder. So a person or a child who is suffering from this disorder, they will have a marked ongoing pattern of inattention and or hyperactivity or impulsivity that interferes with functioning or development. So children who are suffering from this disorder, they will have problem in attention, as well as the children will be very much hyperactive, and the child will also have impulsive behavior. So because of all this behavior, the child daily functioning or the child day-to-day activities will interfere with the child daily functioning and the child day-to-day activities. Not only that, it will interfere with the child normal development. And this term ADHD was first given by Heinrich Hoff in the year of 1854. Now coming to epidemiology, according to CDC, that is Center for Disease Control and Prevention, they have given a report in 2016 that approximately 11% of children who were in the age group of 4 to 17 years of age have been diagnosed with ADHD worldwide. So as per the report, they have found out that 6.4 million children were suffering from ADHD across the globe, and approximately 237,000 children who were in the age group of 2 to 5 years have been diagnosed with ADHD in United States. Now the types. Coming to types, these types were given by DSM-5. So according to DSM-5, they have classified ADHD into 3 types, which the first is predominantly inattentive, second is predominantly hyperactive and impulsive, and the last one is combined. So in the first type, we can see the child will have problem only in attention level, and the second type, the child will have problem in hyperactivity as well as impulsive behavior, and in the third type we will see that the child will have all the characteristics like inattention as well as hyperactivity and impulsive character can be seen in the third type, that is combined type of ADHD. So these types were classified by DSM-5. Now coming to the etiology, so the first one is genetic factors. So in the genetic factors, they say that monozygotic twins, they have a higher chance of getting affected as compared to dizygotic twins, and siblings who have been diagnosed with ADHD in the family has a higher chance of getting affected. So suppose like in a family, if one sibling is diagnosed with ADHD, then there is a high chance that the other sibling will also get affected with this disorder. And also the biological parents who have been diagnosed with ADHD in their earlier age, or who have suffered from ADHD, have a higher chance of getting transmitted to their children. Now the next one is exposure to any kind of substance like cigarette smoking, alcohol use or drug use during pregnancy can affect the child after delivery. So during pregnancy, if the mother is exposed to any such substance, it may disturb the child's normal brain development, and due to that the child will be on a higher risk of getting affected with this disorder. So the next is biochemical theory. So biochemical is all related to the chemical reaction that is going on in our brain, right? So in this disorder, they found out that a child who is suffering from ADHD will have deficiency in dopamine level as well as norepinephrine level, and because of deficiency in these two neurotransmitters, that is dopamine and norepinephrine, it will affect in the activity of the brain, and because of that overactivity can be seen. Now next is prenatal, perinatal and postnatal factors. So in the prenatal is nothing but during pregnancy when the baby is in the mother's womb. Perinatal is after delivery. at the time of delivery, and postnatal is after delivery. So what are these factors? We will see. During prenatal stage, if the mother is exposed to any toxins or exposed to any chemicals, or when there is any prenatal mechanical insult to the fetal nervous system, that means during pregnancy, when due to any invasive procedure, if they have harmed the baby fetal nervous system, or if there is a damage to the fetal nervous system, can have a higher chance of have a risk of getting baby will have a higher risk of getting affected with this disorder. Now the second one is perinatal is during delivery, right? So any premature delivery or any fetal distress at the time of delivery, or precipitated or prolonged labor at the time of delivery, and any prenatal labor and low APGAR score can also be the cause. And the next is after delivery, during postnatal period, if the baby has any infection, like infection related to meningitis, encephalitis, or if the baby is born with any CNS abnormalities like hydrocephaly, microcephaly, or if the baby suffer from any trauma after delivery, trauma related to brain. Okay, so these are the prenatal, perinatal, and postnatal factors which can have an increased chance of getting affected to the baby because of these factors. Now the next factor is the environmental factor, where during pregnancy, if the mother is exposed to any environmental toxins, like toxins related to chemicals, or toxins related to substance, okay, like chemicals like mercury, lead, pesticides, or if the mother is exposed to any substance like alcohol, tobacco, marijuana, like that. Okay, then next is low birth weight can also be the cause. Then any brain injuries can be the cause, maybe during the prenatal stage or postnatal stage, or during the perinatal stage. In the prenatal stage, as we have discussed, that during gestation or during pregnancy, due to any invasive procedure, if they have harmed the baby fetal nervous system, or in the prenatal stage, during delivery, if they have delivered a baby by use of any instruments like forceps delivery or ventouse delivery, and due to this instrument, if they have causes an injury to the fetal brain, and postnatal after delivery, if there is any trauma related to brain, can contribute to this disorder. All right, so the next one is psychological factors. So in psychological factor, we can see that emotionally deprived children, okay, children who belong to where the parents show less affection, love and affection, or care, or where there is less emotional attachment between the child and the parents, and also when there is disturbance in the family equilibrium, disturbance in family equilibrium, in a sense where there will be a conflict, everyday conflict, or where there is a divorced parents, or where neglect of the family by the neglect of the baby from the parents. So all this can lead to a psychological disturbance to the baby, and because of this, the child may get affected with this disorder. All right, so the next one we will see is the clinical features. Okay, so here in ADHD, you can see the three core symptoms, where the first one is inattention, second is impulsivity, and hyperactivity. So these three core symptoms can be seen especially in a child who is suffering from ADHD. So what are all these symptoms? When a person is having inattention, impulsivity, and hyperactivity, what type of symptoms the child may exhibit? We will see one by one. Okay, so the first one is in inattention behavior. The child will be always disorganized. Because of their inattention behavior, the child will be always disorganized in everything they do, because of their less attention span, or since their level of attention is very low. Because of that, they will be very much disorganized as compared to other normal children, and they will have lack of focus. Also, they will have difficulty in giving attention to details. If you are giving any detailed instruction, or if you are giving some instruction to the child will not be able to grasp that attention. Okay, the child will not be able to grasp that information that you are giving to the child because of their less attention span, and also the child will have trouble staying on topic while talking because of their problem in attention. When you are communicating with a child, they will not be able to stay on one particular topic. Instead of that, they will interrupt you during the conversation. And next is hyperactivity. So in hyperactive behavior, we can see that the child will be always fidgeting. They will not be able to sit still in one position. All right, they will be always fidgeting, screams around when they were seated, and they will always get up from their seat frequently and walk around or run around and disturb others. And they will also have trouble in playing quietly or doing some quiet hobbies, since they are very much hyperactive. Because of that, they cannot do things which are related to quiet things. And the next one is impulsivity. So in impulsive behavior, we can see that the child will be very much impatient for everything. For every task that you give to the child will not be able to complete the task because they will be very much impulsive, and because of that, their patience level will be very low, and also they will have a hard time in waiting to talk or react. Okay, since they are very much impulsive, they will not be able to wait for their turn to talk or to react in any situation, and they will blur out answer before someone finishes asking them a question. So before you even complete your question, the child will stood up and they will give you the answer, whether it may be wrong or right. Okay, so these are the symptoms which we can see according to the symptoms like inattention, hyperactivity, and impulsivity behavior. Okay, so the next one is diagnosis. So how can we diagnose a child who is suffering from ADHD? So ADHD children can be diagnosed in between the age group of 6 to 12 years. Remember this, okay? Between the age of 6 and 12 years, we can diagnose a child who is suffering from ADHD, and the diagnosis is made based on the teacher. Why? Because most of the time we know that children, most of the time they spend their days in school, right? So maximum of their time they spend with a school teacher. So school teacher will know much more better than anyone. So we have to take a thorough history from the school teacher of the child and also from the parents, as we know that after the school, the remaining time the child spends with the parents or to the caretaker, whoever is taking care of the child, right? So we have to take thorough history from the parents or the caretaker who is taking care of them, because they know the child's behavior better than anyone. And also we can do some, along with that, we can do some clinical examination. We can do clinical examination like the thorough medical examination, which are related, and we can also do some CT scan. Then you can also do a neurological examination, and you can also examine the hearing and vision of the baby. So the next one is the course of illness. What is the course of illness for this disorder? So they found out that majority, that is about 80% of the patients, can improve when they reach the puberty. Okay, the symptoms may subside when the child reaches a puberty age. But again, they found out that few people, that is 20%, may have persistent symptoms even in adulthood. So if these symptoms are not treated at an initial stage, the symptoms may remain in the child's behavior, and it can carry till adulthood. So nowadays we can even see adult ADHD also. And the next, impulsivity and inattention are the most common residual features. So we have seen that they are the three core symptoms, right? One is hyperactivity, next is impulsivity and inattention. So among these three symptoms, impulsivity and inattention are the common residual symptoms. Okay, residual is nothing but the remaining symptoms, right? Even if hyperactivity may be cured, impulsivity and inattention may remain in the child's behavior even if the child grows up. Okay. So the next one is treatment and therapies. So in the treatment, pharmacotherapy treatment, here we give is stimulants. Okay, so stimulants are administered to the children who are suffering from ADHD. So dextroamphetamine 10 to 40 mg per day can be given, and methylphenidate 10 to 60 mg per day can be administered to the child. And we know that each drug has a side effect, right? So these side effects should be kept in mind when we are administering this drug to the children, or we have to educate this side effect to the parents, because parents will be anxious or they will be worried when they see this type of side effects to their children. So the side effects are: stimulants can raise blood pressure and heart rate, and it can also increase anxiety level of the child. Okay, and some of the contraindication for these drugs are high blood pressure, seizure disorder, heart disease, glaucoma, and liver and kidney disease. So in such disorder, we should not administer drug to the children. So the next one is some of the non-stimulant drug also we give, that is clonidine, imipramine, prupropine, venlafaxine, chlorpromazine, thyroxine, and lithium carbonate. All these medications are also given apart from non-stimulants. Okay, so this medication can improve the focus of the baby as well as attention level of the child, and impulsivity in person with ADHD can be reduced with this medication. Now the next one is psychotherapy. We should also give psychotherapy along with the pharmacotherapy here. So behavioral therapy is very important for a child who is suffering from ADHD. So in behavioral therapy, we have to instruct the caretaker or the parents to always give a positive communication to the children. Whatever communication they are giving to the child should be always positive. There should not be any negative statement. All right, and also that we should allow the parents to give a positive reinforcement to the child whenever the child finishes the task or whenever the child follows the rules and regulation. Like for example, today you tell the child to sit quietly for 5 minutes. Now if the child sits quietly for 5 minutes, you have to praise the child. You have to give positive reinforcement. That is, you have to praise the child, or you should give a chocolate to the child, or you should buy the child's favorite toy. In that way the child will get motivated and the behavior can be enhanced. Okay, and also instruct the parents to have a structured and disciplined routine for the children in order to make the in order to bring the child on the track. Understood? So this type of behavioral therapy can be taught to the parents. And also education and training to the parents is also very important, since the parents will be undergoing a lot of stress to take care of the child who is suffering from ADHD. Therefore we should educate the child parents. Next is parenting skills training can be given, where the behavioral parent training management training can be done. So here what we can do is, you can advise the parents to always give a reward whenever the child does a good job, or whenever the child follows the parents' instruction. We should always advise the parents to give a reward to the children in order to motivate their behavior, or in order to encourage their positive behavior. All right, and give positive feedback for desired behavior. You should tell the parents to always give a positive feedback whenever the child does any good behavior. So if the child listens or focuses attention for 10 minutes or 5 minutes, then you should always tell the parents to give positive reinforcement. And sometimes you should also instruct the parents to ignore or redirect undesired behavior. Suppose the child is showing tantrum or is showing some hyperactive behavior, then you should instruct the parents to ignore the behavior to some extent. If the child is going extreme, then they should go and attend, but to some extent the parents should ignore the child, and in order to restrict that undesired behavior. All right, so some of the tips to help kids with ADHD, some of the tips, this type of tips you can teach to the parents. Okay, so what are the tips that need to be taught to the parents are: keeping a routine and a schedule. You should encourage the parents to keep a routine and a schedule for the child. Like for example, the child should wake up at this time, go to toilet at this time, brush his or her did at this time, take a bath at this time, and this time the child should take a breakfast, at this time the child should do his or her homework, and at this time the child should sleep. All these routine schedules should be prepared for the child. Then next is organize everyday items. So since the child is very much hyperactive, the child may not like when you take out any items, or when you take out any items, or when you misplace, or when you replace the old items with the new items. So because of that, you have to organize each and every items in a systematic way, so that the child may, in that way the child will able to cope up with those disorganized behavior. Alright, so everything, whatever the child needs in a day, should be organized in an orderly manner, so that the child should follow those steps in order to improve his or her behavior. And next is, you can also advise for homework list, using homework and notebook organizer for the child. Whatever the child has to do today, all these things, homework and should be listed down and has to be given to the child. And also you have to be very clear and consistent in whatever you are talking to the child, because the child may lose his or her attention in between, right? And the child may not be able to follow your instruction, since the child gets easily distracted. Okay, so because of that, you should be very clear and consistent in whatever you talk or you communicate with the child. And also giving praise or reward when rules are followed. This we already discussed. We have to always praise and give a reward to a child whenever he or she follows the rules, in order to improve their behavior, okay, or in order to encourage their desired behavior. And the next one is keeping a routine. This we already discussed, right? We have to always keep a routine, so that the child may go on the track, or the child may not lose his or her attention. And making lists for different tasks and activities, you can also make a to-do list for the child in order to finish up his or her tasks, daily tasks. Then next is, you can use a calendar for scheduling any events for the child, and use a reminder note for the child. Then the next one is, if you are teaching any new skills to the child, you have to always break down the large tasks into a more manageable one. Okay, all the big tasks, if you are teaching to the child, you have to cut it short into smaller steps, so that the child will have a sense of accomplishment. And not only the child, even the parents or the caretaker also should have a sense of accomplishment, and in that way the child will get motivated to go on with the new behavior that he or she has acquired. Now coming to the nursing management, how can we manage a child who is suffering from ADHD? So the first one is, we need to always develop a trusting relationship with the child. Okay, why? Because if we don't develop a trusting relationship with the child will not share any information with you. So because of that, we have to always develop, first of all, we have to develop a trusting relationship with the child. Then next, we have to ensure that the patient has a safe environment. Okay, wherever the child is, in which environment the child is, we have to always see that all the environment is clear, and no sharp articles should be there in front of the child, or in and around where the child stays. Why? Because of their impulsive behavior, the child may harm himself or others, right? So because of that, the environment should be safe, and provide an environment that is free of distraction. Why? Because the child gets easily distracted, and they always loses their focus because of their less attention span. So because of that, we have to keep the environment clear and keep the environment free of distraction, and ensure the child's attention by calling his name and establishing eye-to-eye contact before giving any instruction. So if you happen to give any instruction to the child, before giving any instruction, you have to make sure that the child is listening to you and the child has an eye contact with you, so that the child listens or grabs all the information that you are giving to the child. Okay, and also ask the patient to repeat instruction before beginning any tasks. Why? Because of their lack of attention span, the child may not follow your full instruction, right? So before the child finishes begin any task or starts any task, you need to tell the child to repeat the instruction that you have given to the child. Then only the child should begin the task in order to accomplish the task. Okay, because why? If you don't do like that, the child may forget the instruction in between, and the child may not finish the task, and because of that, that will let the child self-esteem to go down, or that will disturb the child confidence level, right? So because of that, we have to always reassure ourselves that the child should repeat the instruction that we are giving, and the child should always finishes the task. And next is offer recognition of successful attempt and positive reinforcement for attempts made. This we have already discussed. Whatever task that the patient has completed, or whatever successful whatever task that the patient has successfully completed, you need to always give recognition by praising the child or by giving some reward to the child. Okay, and provide information and materials related to the child disorder and effective parenting techniques. So whatever tips that we have discussed, those information can be shared to the parents, so that the parents may learn on how to deal with the child. Then coordinate overall treatment plan with the schools, collateral personnel, also the child and the family. So we need to correlate our treatment with the school teacher, because most of the time, as I've already said, the child spends his or her days in school. So we have to coordinate our treatment with the school teacher as well as with the collateral personnel, maybe of the medical team or the treatment team, and as well as the child and the family members of the child. So do you have any doubt? If you have any doubt, kindly let me know after the class. Alright. Then coming to the conclusion, so ADHD is a condition in which a person will always have a problem in inattention. They will also have problem in focusing a task, as well as they will also have the tendency to act without thinking, and also they have problem in sitting still. So the child who is, remember that the child who is suffering from ADHD will have inattention, hyperactivity and impulsivity, and we can see that all these symptoms can start at an early childhood and may continue till the adulthood without treatment. So without proper treatment, it may continue till adulthood. So initial screening and treatment is very much necessary, and ADHD can cause problem at home, at school, at work, and with the relationship that the child has. Alright, so these are my references. So I hope everyone is clear with today's class. Thank you so much, everyone. If you have any doubt, kindly let me know. Alright, thank you so much.